I'm Dr. Morningstar. I work at the Natural Wellness and Family Centers in Blank. Been there for, it's my 11th year of practice, 12th year of practice next month. And so I'm a chiropractic neurologist by board certification. And we tend to treat a lot of chronic pain. And I always try to differentiate chronic pain from an acute pain episode that a lot of people will have intermittently that most treatments, conventional and alternative, help pretty straightforwardly. What I'm talking about is more pain that's long-standing, doesn't respond to most therapies, or even if it does respond on a temporary basis, it repeatedly comes back, whether it comes back every week or a few days to a few hours after they receive a treatment that helped. And so this is the type of pain episode that I'm talking about, the kind that just really is very resistant to anything. And I kind of go through today, we attack this from very specific origins, but as you'll see throughout the presentation, they all kind of intermingle together, and realize that when we talk about any type of a diagnosis, whether we talk about Lyme disease, Rebecca already mentioned, or fibromyalgia, in reality a lot of those types of problems are really interconnected and they're really one and the same. So from our perspective, we're not looking to label somebody with a diagnosis because that doesn't really help them. What really the goal is to find out what functional problems is that person having within, solve those, and then let everything else kind of right itself, which provides more of a long-term solution. I think most people will agree. Chronic pain is defined as pain existing for greater than 3 months, but some researchers actually will predict more like 2 to 3 weeks. So again, most acute pain episodes are classified as anything up to and including 2 weeks. Recognizing that the body will handle most any pain episode in 2 weeks in an acute situation. Your body will adapt to that injury, repair that injury, whatever it might be, and the pain will subside and you will not have a problem again from that injury. However, if it starts to last beyond that time threshold, a lot of people already call it a chronic situation. That is kind of a double-edged sword. And the reason is in terms of medical care, anything that's considered chronic, most times, as many people know, is not covered by insurance. They will cover most acute pain episodes very easily, but if the pain continues beyond a 2 to 3 week interval with no change or very little change, everything at that point is considered experimental for the treatment of chronic pain, so insurance companies don't want to treat anything that's for chronic pain. You're going to see a lot of, I'm very visual when I teach, so I like to put in a lot of graphics. So. Okay, now, I think in any chronic pain situation, whether we're talking about somebody herniating a disc in their back, or somebody being diagnosed with fibromyalgia, or somebody having even rheumatoid arthritis, all of those situations are precipitated by or dramatically intensified by not adapting to stress. The idea is everybody in here has stress. That you can't avoid it, obviously, especially in today's society where we have stress from anything from financial issues. It seems like everybody at this point is worried about health insurance and if they're going to have any, and if they're even going to have their job because of health insurance changing. There are a lot of things right now that people are really worried about and legitimately so. People have family stress, marital problems. People have financial problems in the household. There are all sorts of stress. You can't avoid it. There are other types of stress, too, that are not quite so obvious. Things like electromagnetic fields cause stress in the body. Chemical stress from toxic or heavy metal exposure, pesticide exposure, etc. There's also stress from physical stress, the way you perform your job. Maybe you're a semi-truck driver and you're in your truck for 18 hours a day. Maybe you're a computer programmer and you have terrible sitting posture most of the day. So there are a lot of sources of stress that our body has to deal with. And depending on how well our body deals with stress determines first of all, how well our resistance, our immune system, is able to fight things off as we come in contact with them. But secondly, how well do we even initially mount an immune response in the first place? As an example, this right here is what's called General Adaptation Syndrome Model by Seeley. And of course, it's way back in the early 70s when it started. But what this is this an idea of what happens in our body during a stressful event, okay? So, we're out here living our lives, and this is our normal immune response, okay, to stress. Our normal, even more broad than that, it's our body's ability, whether it's my liver, or my heart, or my brain, kidneys, everything, to be able to handle stress, okay? How they all handle it, deal with it, put it aside, and move on. Stress starts here at point A. So something happens. Let's say you find out your boss just told you had to work on the weekend and you have front row tickets to the Lions game. I don't know if anybody likes football. So now you spent several $100s on these tickets. It's obviously stressful because now you got to figure out what to do with these tickets. Obviously your body responds by creating stress hormones to help you deal with the stress. Those main stress hormones are cortisol and your adrenaline hormones, okay? Well, let's take a more serious example. You're walking along the street that you witness a car wreck and somebody's trapped inside a car. Obviously, that creates stress for you. Your body kicks in. You've heard about people who, they literally lift cars up to pull people up. Why? Because they have a surge of adrenaline that helps them adapt to that stress, okay? Now, here's where the problem comes in. Take the car accident. Car accident goes away, you lift the car up, person's out of danger, everything goes back to status quo. You should eventually go back down to A and keep going down here, okay? But here's the problem. Car accident goes away, now the police want you for a statement, now you have all these other things going on, now your wife's wondering where in the heck you were and you didn't come home for dinner and blah, 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 blah. So you always have stress, okay? So the problem is you're never allowed to come back down. So there gets to a point in time where your body, your adrenal glands specifically, have to keep making this higher amount of stress hormone. And there just gets a point in time where it crashes because they just poop out on it. They're like, look, I can't keep up with demand, I'm done. And then you go into what's called adrenal exhaustion, and when you're down here, you hit something called adrenal fatigue. Okay? It's at that point in time, when you can no longer handle stress, that the next time you have a stressful event happens, you can't handle it, and now you either have a nervous breakdown, you start having anxiety attacks, you start not being able to sleep, and that's what makes you sick, period. Okay? So anything I talk about, again, whether it's fibromyalgia, whether it's Lyme disease, I think a lot of people probably are more exposed to Lyme disease than we think. It's just some of us are sick and some of us aren't because of things like this, period. Okay? Sources of chronic pain, main things I'm going to talk about. First off, autoimmune disorders, heavy metal toxicity, Lyme disease, fibromyalgia, neurotransmitter imbalances, degenerative disc and joint disease, and post-surgery syndrome, or what we also call failed back surgery syndrome. Again, going back to the stress situation here, when we talk about stress sources, you can see we have quite a list here, so it's not like we're not at a lack of stress. And they actually categorize it male versus female, and who perceives stress from what areas more. So same thing, we talk about, and you can see it in here, cortisol and your two adrenaline hormones. You have, whether it's financial, environmental, social, we have all these sources of stress that come in. They create pressure in the system, whether it's perceived stress or a type of physical stress, postural stress as an example. And it activates your stress response. It activates what we call your fight or flight mechanism. Okay? And that's your surge of adrenaline, your surge of stress hormones to help you deal with that immediate situation. Here's the problem. Cortisol and adrenaline have other impacts on all of your internal organs, some good, some bad. As an example, prolonged excretion of cortisol creates insulin resistance, which also makes you prone to type 2 diabetes. So there are detriments to having constant levels of these stress hormones secreted in the body. So a lot of people consider stress management techniques to deal with it. And those are very valid, and we do them in our office ourselves from time to time. The bigger goal, however, becomes to build your body back up so that you can handle stress in concert with trying to limit your external sources of stress. You're never going to totally eliminate them, but you can manage them better. For a lot of people, what we find in the office, it's more of a time management situation for a lot of things than anything. And as soon as they get that under control, the rest of this starts to ease off, especially as we rebuild their adrenal glands, stop this from continually happening, and then build up their immune system again.